Antibiotic resistance is a widespread problem facing the world. While many factors play a role in the spread of antibiotic resistant organisms, one of the biggest reasons comes from the short lifespans of these microorganisms and their ability to reproduce at a comparable rate. This allows natural selection to act very effectively. This may not regularly pose an issue to everyday life, however, in the preventative world we live in, proactive measures to prevent these problems can arise quickly. Hospitals are one big source of this problem. After surgery, patients are put on some form of broad spectrum antibiotic to avoid infection, but not end the infection. This can easily allow for infection causing organisms to evolve and be unaffected by the standard post surgical antibiotic that is given. One other place that this can begin is at home. When you are prescribed an antibiotic to take in a strict schedule, it is to hit the bacteria hard enough that it cannot develop resistance over time. However, if a person does not follow the schedule or does not finish the dosage prescribed, it allows for the bacteria to change and resist the effect of the drug. Common pill disposal is used to flush excess drugs down the toilet as well, which exposes any nearby microbes to low dosages of the drug and allows for a broader number of bacteria to develop resistance.
Carbapenem-resistant Enterobacteriaceae, or CRE, is known as the superbug because of its high resistance to a wide range of antibiotics. It specifically creates an enzyme that allows the resistance of carbapenem antibiotics that treat severe infections within patients, mostly found within the gut area in forms of Klebsiella and E. coli. If this bacterium gets into the blood, urinary tract, or the lungs, it can cause serious infections within the infected person.
Carbapenem contains a beta-lactam ring in its molecular structure, which classifies it as a beta-lactam antibiotic. Carbapenem is a very small molecule which can enter the periplasmic space by passive diffusion through porin channels in the outer membrane. The carbapenem drug will bind to the penicillin binding protein, also known as PBP, to disrupt synthesis of the peptidoglycan, an essential element of the cell wall, and cause the bacteria to burst and die. There are three mechanisms that can coexist for gram-negative bacteria to confer resistance to beta-lactams. The bacteria can produce beta-lactamases, cause changes to the porin channels, or cause changes to the efflux pumps. The beta-lactamases are secreted from the bacterial cytoplasm and into the periplasmic space, which will bind to and break the beta-lactam bonds of the antibiotic to make the antibiotic inactive. A change to the bacterial porin channel includes either a decrease in the number of channels or a mutation in the amino acids of the porin channel to restrict entry. The efflux pumps are large proteins that span from the inner to outer membrane of the bacterial cell. These pumps will expel any toxins in the cell, including antibiotics. An increase in efflux pumps will remove the antibiotics more quickly to prevent interaction with penicillin binding proteins. Bacterial cells who become carbapenem resistant can form plasmids and pass their resistance genes to other cells.
In 2014 and 2016, 6 patients in Colorado were diagnosed with a UTI, which is not strange because UTIs are actually the most common bacterial infection in the United States. But the thing that made these cases unusual was the fact that each of these infections were caused by bacteria that were carbapenem resistant. CREs tend to target individuals with weakened immune systems, which is why we see many patients in healthcare settings being infected with the CRE while at acute or long-term care facilities. CREs can be spread from person to person through physical contact or medical devices used in surgical procedures, and once inside of the body, they can spread throughout to cause a wide variety of deadly infections in the gut, urinary tract, and even the bloodstream. Once someone with a weak immune system has been introduced to a CRE and it has spread, options for treatment are very limited. The best way to put a stop to this superbug is by being aware of various prevention methods in our personal lives and also in healthcare settings.
A simple task that we can all do to prevent the spread of these superbugs is to consistently have good hand hygiene. Facilities should also provide suitable hand washing stations and make sure supplies are always stocked. Correct use of alcohol-based sanitizers is also known to support healthy hand hygiene. But in medical establishments such as acute care hospitals, the use of gloves and gowns by themselves cannot completely prevent the spread of deadly bacteria. Complete hand sanitation before and after the use of surgical wear can also greatly decrease the spread of bacteria in and out of a patient's room. Disinfecting all medical devices and objects that have come in contact with previous patients is also extremely important. As we mentioned before, CREs are more damaging to those with a weaker immune system, so in maintaining a proper diet, sleeping habits, and exercise, we can greatly reduce the risk of harm by CREs.